public health, what is it? What is public health? The mission of public health is to promote physical and mental health and to prevent injury, disability, and disease. And you can see public health here on UNCG's campus, and you can see it firstly on the sidewalks which I'm walking on, because they provide students a safe place to walk so that they won't get hurt or hit by cars. You also see public health through our use of trash cans like behind me in the corner and recycling bins so that we can throw away things that are dirty and it doesn't mess up our environment, so that we can keep the beautiful gardens like that are pictured all around me. And we can also see public health in water fountains where we can have clean water for students to drink and promote hydration here on our wonderful campus. And you can also see it in our kitchens where that we follow health standards to make sure the food is healthy and that there's no contamination or cross-contamination. You can also see how public health's importance through community educations that work really hard in health education. And one of these places that I actually got the chance to visit is the Pitt County Coalition on Substance Abuse, where they focus on opioid misuse and abuse, and they focus on underage drinking. And they focus on the underage drinking with the youth team, where they partner with high schools to go into high schools and talk to them about what are alcopops and how they are affecting our youth. And you can also see them more tackling the opioid problems and the opioid epidemics with them promoting needle exchanges and getting needle exchanges in Pitt County and educating the community on what those are. You can really see them partnering with other organizations when it comes to hosting their STOP series and talking about how we can all work together and collectively stop the opioid epidemic. And they partner with the Pitt County Coalition on Substance Abuse to do this, the NC Harm Reduction Board, Vidant Medical Center, and law enforcement. And you see them come in and people from PICSA give their personal stories about what's going on and what it's like to be addicted to a substance and overcome it. And then you have law enforcement talk about the law enforcement side and doctor shopping and what's going on there. And then you have Vidant coming in on the medical side. How are these people getting the drugs and what's going on with that? And you have harm reduction coming and talking about the needle exchanges and how needle exchanges can help, because needle exchanges are what people can bring dirty needles or use needles and exchange them for clean needles and learn about treatment options and what treatment options are available for them. You can see that their work has given results with now every other Saturday there is a needle exchange in Pitt County, and this was a major win for the Pitt County Coalition on Substance Abuse. They're hoping with this they can help lower the AIDS rate and the hepatitis rate, because now there won't be as many dirty needles on the streets that have been used. And you can see really public health, this is how we save lives, this is how we make differences. We fight for changes by assessing what's going on in the community, what the community needs. They saw that there was a need for someone to combat opioids and people doing prescription drugs. You can see that they used assurance to do that. They used policy development to talk with people about getting a needle exchange in Pitt County and making sure it was legal with the county commissioners to have it. And then they have assurance by maintaining this and keeping it there. Those are the core functions of public health, and we can see them being done and enacted here at UNCG in our local communities and in our research labs where we do cutting edge research in public health. So no matter whether it is research, implementation, or here at UNCG, great things are happening at public health, where we are changing lives one step at a time in all facets. If you look around, more than likely you're seeing public health. A lot of times we go unnoticed, but we are here doing the work, boots on the ground, to ensure that you have a healthy and safe life. Thank you for learning and hearing about public health and what my experience was.